Hello everyone. Today I will be presenting on the comprehensive management of open abdomen, focusing on the principles, techniques, and outcomes associated with this critical condition. My name is Adiodatus Yuda Handaya, and I am honored to bring insights from my clinical and academic experience at Sarjito Hospital and Gajah Mada University, Yogyakarta, Indonesia. In this presentation, I aim to address 5 key objectives. First, we will define what open abdomen (OA) is, providing a clear understanding of the concept. Next, we will discuss the indications for managing OA and when such an approach is necessary. Following that, we will review the techniques used for temporary abdominal closure. We will then analyze the potential complications that may arise and discuss strategies for their management. Finally, we will examine the outcomes and explore recent advancements in the management of open abdomen cases. These objectives will guide our discussion and ensure a comprehensive understanding of this critical surgical topic. We begin with the definition of open abdomen (OA) or enteroatmospheric (EA) condition. OA is characterized by a surgical scenario where all layers of the abdominal wall are left open, often as part of a damage control or life-saving intervention. Additionally, we define enteroatmospheric fistula (EF), which occurs in the context of an open abdomen. This condition involves the formation of a communication between the gastrointestinal tract and the external environment, posing significant management challenges due to the risk of infection and fluid loss. These definitions set the foundation for understanding the complexities of managing open abdomen and associated complications. Clinical relevance of open abdomen (OA). OA is a crucial technique in various emergency and complex surgical scenarios. It is used as part of damage control (DC) surgery to stabilize patients in life-threatening conditions. It allows management of intra-abdominal sepsis or vascular emergencies, where immediate control and delayed closure are necessary. OA facilitates second-look laparotomy, particularly when bowel viability is uncertain or surgical packs need to remain in the abdomen temporarily. It helps to prevent or treat abdominal compartment syndrome (ACS), a critical condition caused by increased intra-abdominal pressure. Finally, OA is essential for managing post-operative complications, such as bowel edema or anastomotic leaks. These points emphasize the importance of OA in modern surgical practice as a life-saving and complication-preventing strategy. How an open abdomen (OA) can predispose a patient to develop an enteroatmospheric fistula (EF). One of the primary reasons is manipulation of the bowel, which often becomes edematous and friable in the open abdomen setting. Frequent abdominal dressing changes further exacerbate the risk by disrupting the delicate tissues, ultimately leading to the development of an EAF. This highlights the need for careful handling and meticulous management of the open abdomen to minimize complications like EF. Pathophysiology of open abdomen (OA), which involves 3 critical aspects: increased intra-abdominal pressure, which can lead to significant physiological disruptions and complications if not managed properly. The systemic impact of OA, affecting major organ systems such as the respiratory, cardiovascular, and renal systems, highlighting the importance of multidisciplinary management. Finally, the healing dynamics and challenges unique to the open abdomen, which include delayed closure, risk of infection, and the development of complications like adhesions or enteroatmospheric fistulas. Understanding these key points is essential for optimizing the management of patients with OA. Algorithm for managing the closure of an open abdomen (OA) after damage control surgery. The process starts with assessing whether a repeated laparotomy is required. If a repeated laparotomy is necessary, Barker's dressing (BD) and medial traction (MT) are applied, followed by re-evaluation. If closure is possible, definitive closure is performed. If closure is not yet possible, vacuum-assisted closure with medial traction (MT) is recommended. After 14 days, another assessment is done to determine the feasibility of closure. For cases where closure remains unachievable, the next step is delayed abdominal wall reconstruction. This structured approach ensures optimal patient outcomes by balancing timely interventions and minimizing complications. Initial management principles for patients with an open abdomen. There are 3 critical steps to ensure optimal care: hemodynamic stabilization, which focuses on maintaining adequate blood flow and organ perfusion to prevent further deterioration; infection control, which is essential to minimize the risk of sepsis and other complications associated with an open abdomen; assessment and preparation for abdominal closure, whether temporary or definitive, to ensure timely and appropriate surgical intervention. These principles form the foundation of effective open abdomen management, prioritizing patient safety and stabilization before definitive treatment. Bjork classification of open abdomen, comparing the versions from 2009 and 2016. This classification helps guide the management of open abdomen by categorizing cases based on their severity and characteristics. Grade 1 represents clean open abdomen OA or contaminated OA without adhesion or fixation. Grade 2 describes cases with developing adherence or fixation, either clean or contaminated, or those involving an enteric leak. Grade 3 highlights frozen abdomen scenarios where the bowel is adherent or fixed, increasing the complexity of management. Grade 4 refers to the most severe cases with established enteroatmospheric fistulas and frozen abdomen. The updated 2016 classification refines the criteria to improve clinical decision-making and patient outcomes in managing complex open abdomen cases. Thank you for your attention throughout this Part 1 video lecture presentation. I hope the topics we've covered have provided valuable insights into the management of open abdomen cases. To know more details, you can continue to the next part of the video lecture.